All right. Well, hello, everyone. Thank you so much for joining us today for the Kennebec County Nutrition and Breastfeeding Support Work Group. My name is Sarah Young. I use she, her pronouns. I am the Healthy Eating and Active Living Coordinator here at Healthy Communities of the Capital Area. Today, we are joined by two dedicated public health professionals from Healthy Communities of the Capital Area, a.pellerin, who is the Substance Use Prevention Coordinator, and Isabelle.Stevens, who is the Tobacco Prevention Coordinator. Anna and Isabelle work to promote healthier communities across the region by providing education, resources, and support around substance use and tobacco prevention. Their efforts focus on helping individuals and families make informed choices that support long-term health and well-being. In today's conversation, they'll be discussing an important and sensitive topic: pregnancy, substance use, tobacco prevention, and breastfeeding. Exploring how these issues intersect, the impacts on maternal and child health, and the prevention strategies and supports available to expectant parents and healthcare providers alike. Please join me in welcoming a.pellerin and Isabelle.Stevens.
Thank you, Sarah. I can get us started, Belle. Thank you. Welcome. Today we're going to be talking about the impacts of cannabis, tobacco, and nicotine during pregnancy and breastfeeding. Our goal is to share what current research says, what health organizations recommend, and where to find support for parents and caregivers. Right. So Healthy Communities of the Capital Area, we're a public health nonprofit organization working with local public health districts, state level government, and we do this to create healthy, thriving environments. I'm sure if you've been a part of this group, you probably know a little bit about us. All right, so this is just a little outline. So we'll be looking at cannabis use and its impacts, then moving on to tobacco use and nicotine impacts, and then we'll end with time for some questions and some key resources as well. We just want to provide a disclaimer here. We recognize that these are sensitive topics and we may touch on things like pregnancy loss or substance use. And if you need a moment or want to step out, please feel free to do so. This is a safe space. Right, so I'm going to jump right into some cannabis. I want to do some basics. So cannabis terms. So cannabis, which is also known as marijuana, weed, or pot, contains THC, which is the psychoactive chemical that makes a person feel high. CBD is a compound found in cannabis and hemp that does not cause a high, but it can still contain trace amounts of THC. Hemp is a variety of the cannabis sativa plant that contains very low levels of THC. Cannabis products come in many different forms. I have a few listed here. So we have like edibles and drinks, smokable products, vapes, dabs, topicals, and there is always something new coming up. According to the FDA and CDC, there is no known safe amount of cannabis use during pregnancy or breastfeeding. Okay, so now we're going to discuss an overview of cannabis use during pregnancy and chest/breastfeeding. So first, using cannabis in any form during pregnancy and chest/breastfeeding can be harmful to a growing baby. THC crosses the placenta and enters the baby's bloodstream during pregnancy, which can affect their growth and brain development. If someone uses cannabis while breastfeeding, THC can pass into the breast milk. The CDC reports that THC can remain in milk for at least 6 days after use. So the pumping and dumping method doesn't prevent exposure for a child. Even products labeled as CBD can contain THC, which is often surprising for some people, or they can contain other harmful contaminants like pesticides, heavy metals, or bacteria. We also know that secondhand cannabis smoke can affect a baby's health and their oxygen supply as well. So now we're just going to get into the health impacts regarding using cannabis during these different stages that we have listed here. So research suggests prenatal cannabis exposure may increase risk for premature birth or stillbirth, low birth weight, and possible developmental delays or behavioral challenges later in life, such as issues with attention, memory, or learning. Cannabis use during pregnancy could also cause health problems at birth and throughout life. Additionally, if a pregnant person were to breathe in secondhand cannabis smoke, this could lower the oxygen supply to the baby. So, if there's people around you that do smoke, consider asking them to not do it around you as well, so you don't have that impact on the child. So cannabis use while chest and breastfeeding could lead to babies possibly being sleepier. Therefore, they're feeding less usually, which can turn into a slow weight gain. Brain development may be affected as well, which could lead to things like hyperactivity and low mental performance. There's also that risk for a baby to get those other contaminants through the milk, such as the pesticides, the heavy metals, all those other things that we've been touching on already. And throughout life, respiratory and cardiovascular issues could occur. Again, there's always that potential for brain development abnormalities. And then secondhand cannabis smoke again and accidental ingestion can pose risks. Cannabis use can also impair the caregiver or the parent's alertness or ability to safely care for their baby as well. With that being said, there are some other considerations that we should talk about. So considering the risk versus the benefit of breastfeeding, what I mean is if you are someone that uses cannabis, does that risk of not using cannabis outweigh the benefits of breastfeeding? We recognize that some people use cannabis, specifically medical cannabis, to manage conditions like anxiety, chronic pain, or nausea. The FDA emphasizes that there is no approved cannabis products for pregnancy or breastfeeding. Even for medical use, health providers should help patients weigh potential benefits and risks and explore safer alternatives. The bottom line from the CDC, the FDA, and the American College of Obstetricians and Gynecologists is to avoid cannabis in any form while pregnant or breastfeeding. And then I just want to say a little note I have on here is safe storage. So if you're someone or you have people in your home that do use cannabis, to make sure you're storing it safely. So locking it up, keeping it in a place where children and
Oh, it looks like Anna dropped off here. Um, Belle, would you like to pick this up?
Yeah, I think just to finish Anna's thought, keeping products away from children, pets, or anyone else who shouldn't be using that product. So I think, oh, sorry, her computer restarted. And yeah, Anna can also provide safe storage bags and lock boxes if anyone is interested in connecting with her about that. So it was a good time for her computer to restart because we're going to move on to tobacco. So I'm going to go over the key tobacco terms. Um, so I'll be talking about, or I will not be talking about sacred tobacco, which is a plant considered sacred by many indigenous nations who use it for spiritual and medicinal purposes. I'll be referring only to commercial tobacco, which are products that are used recreationally and are mass produced for profit and contain added chemicals. When I'm talking about commercial tobacco products, I am referring to all products containing tobacco or nicotine, which is a highly addictive chemical in tobacco products, and can also be derived or synthesized to create quote unquote tobaccoless products. And examples of commercial tobacco products include cigarettes, cigars, e-cigarettes, which are also known as vapes, nicotine pouches, hookah, and smokeless tobacco such as dip. So, similarly to cannabis, if an individual uses tobacco products during pregnancy, the nicotine and other harmful chemicals from these products can pass to the baby via their blood and impact development. Examples of harmful chemicals include tar, carbon monoxide, flavorings, and other additives. And for chest or breastfeeding individuals, these chemicals can pass to the baby through milk, Nicotine also impacts milk supply by lowering levels of prolactin and oxytocin and therefore reducing production of breast milk. In addition, the milk of individuals using tobacco products while breastfeeding can have a lower fat content compared to those who do not, impacting the baby's growth and development. During chest and breastfeeding and throughout the lifespan, second and third hand smoke can have significant impacts on health and wellness. And similar to CBD, there is need for additional research on the effects of nicotine during pregnancy and breastfeeding. So looking at some of the health impacts for tobacco for people using tobacco products while pregnant, the potential impacts include premature birth and stillbirth, or lung development, low birth weight, sudden infant death syndrome, birth defects, and impacted ability to suck well for breastfeeding in the first couple of weeks of life, which can also impact milk supply. Potential health impacts for the pregnant individual themselves include complications during pregnancy and birth, as well as a higher risk of postpartum depression. Um, and then tobacco products have widespread impacts in the body, and exposure to nicotine and other harmful chemicals can result in respiratory problems such as asthma, coughs, pneumonia, and bronchitis. It can also lead to more frequent ear infections, trouble sleeping, and increased likelihood of using tobacco products later in life. Exposure to nicotine anytime before the brain is fully developed, which usually happens around age 25, does impact brain development, and it can lead to difficulties concentrating and ADHD, as well as difficulty learning, resulting in poor math and reading skills, difficulty with mood regulation, including aggression and anxiety in situations that don't account for it, and poor impulse control, leading to more risk-taking behavior. There's also concern about accidental ingestion, which Anna mentioned for THC, but ingesting these products can cause nicotine poisoning with symptoms like dizziness and vomiting and can be very dangerous for infants and young children. So safe stores information that Anna shared also applies here, especially for products that have colorful packaging or fun flavors that may be appealing to youth. So we've both talked a little bit about second and third hand smoke, and this does also extend to vapor or the aerosol from vape products. So I wanted to dig a little deeper into what exactly they are and how to keep children safe. And so, like I said, this applies to cannabis and tobacco products. So secondhand smoke is what someone, such as an infant or child, breathes in when they are around smoke or vapor. And third-hand smoke is the leftover chemicals that stick around after someone smokes or vapes. So some ways to avoid exposing babies and children to second and third hand smoke are to avoid smoking around them and to avoid smoking in the house or in the car or any spaces where your infant or child would be present. Third hand smoke can build up on a car upholstery, beds, carpets, toys, and more, and these chemicals can be absorbed through the skin or ingested, meaning infants and children are at a higher risk because they're often being held, crawling on the floor, and putting things in their mouth. In addition, after smoking, it's recommended to shower, change clothes, and brush your teeth before interacting with a child or infant, and this is especially important to do during breastfeeding. Right. I also wanted to touch on tobacco treatment. So I talked about the mitigation efforts around second and third hand smoke, and wanted to talk about our number one recommendation, which is to not to use any tobacco or cannabis products while pregnant, breastfeeding, or in spaces with others. So options for quit services include Maine Quit Link, which is for individuals 18 and older. There is also My Life, My Quit, which is for 13 to 17-year-olds if someone is pregnant or breastfeeding during this time in their life. These are both free, confidential phone-based services with certified quit coaches that anyone can access. With participation in these programs, there's also an option to have free nicotine replacement therapy using options like the patch or nicotine gum. And people who use these services are significantly more likely to have a sustained quit than those who try to do it on their own. That being said, if someone is unable to or unsuccessful in reducing or quitting tobacco products for any reason, it is still recommended that they continue breastfeeding due to its benefits like important nutrients, protections against infection, and minimizing the harmful effects of smoking on a baby. So best practice is to use tobacco products immediately after breastfeeding and then wait at least 2 to 3 hours before breastfeeding again. After about 90 to 100 minutes, nicotine levels in milk decrease by 50%. So even waiting that amount of time is a lot better than breastfeeding immediately after smoking using a tobacco product. So to recap all of this, when we're talking about relative risk, the number one recommendation is not to use any tobacco products, followed by using nicotine replacement therapy to reduce or quit tobacco use, followed by continuing to use the same level of nicotine or tobacco product, but using the best practices that we shared about breastfeeding times and reduction of second and third hand smoke exposure. Okay, these next couple of slides, I'm going to talk about how to make referrals to Maine Quit Link. So this is relevant for anyone who's working with parents or caregivers and might be able to encourage them to reduce or quit tobacco use. So some general questions that you can ask when you're with someone is how they feel about smoking or tobacco use, what they know about smoking and their family's health, their recent thoughts about quitting smoking, and what holds them back from trying to stop smoking. You can also discuss Maine Quit Link with them. So like I mentioned, it's free, it's confidential, for adults 18 and older. And you can let them know that there's phone coaching, there's also online tools. So there's a couple of different options based on what individuals feel comfortable with. So I had mentioned that there's a significant difference in success rate for those who use the service versus those who don't. So trying to quit tobacco products without an evidence-based treatment, such as Maine Quit Link, there's about a 3% success rate of a sustained quit. So that's stopping for 30 days or more at one time, versus with Maine Quit Link, there's about a 40% rate. And that goes to 50 to 60% when someone is using Maine Quit Link and using nicotine replacement therapy. So there's definitely a lot of benefits of using it that you can share with someone. Some common concerns are about how the referral process works, which I'll go over in a second. Um, some people feel like they need to be ready to take action to quit in order to use Main Quit Link, and that's not the case. They'll work with you based on um, where you're at in the journey. So if someone is thinking about quitting tobacco or is like, oh, I know that there's so many benefits, but I just don't feel like I can do it, no matter what stage anyone's at, Main Quit Link is there to support. They also only provide medications approved by the FDA that have been found to be safe and effective. So if someone's concerned about nicotine replacement therapy, these are regulated products that have been FDA approved. And the counselors at Main Quit Link can provide helpful information as you plan so you can make informed decisions that meet their most current needs, which is to say that they'll help the person who's interested in quitting to make a quit plan, make sure it's tailored to them, and check in with them about how it's going. So how do you make online referrals? You can confirm that a parent or caregiver is interested in quitting, and then you can go to ctimaine.org. Under Main Quit Link, select Social Services Provider Referrals, and then scroll down to find the online referral form and fill it out. There's also a tutorial video if that is helpful for individuals. And then this is how you would make referrals using a tax form. So again, confirm the interest. And then there's this fax form. And then you'll fax it to the number on the screen that's also provided on the form. All right, so that was a lot of information. So we'll open it up to questions now.
Wonderful. Thank you both so much for presenting today. That was absolutely wonderful and very eye-opening and insightful. You had mentioned that there were some resources that you could both provide. How in that situation should we be getting in contact with you in order to, distribute any of these resources or learn a little bit more?
We can put our emails in the chat. And definitely you can reach out to us by email and we can drop off resources for you. We can get them, like if it's print resources printed, and we can drop those off for you. And then if you want like lock bags or safe storage materials, I can drop those off as well.
Yeah, and if there's no other questions, we do have a quick little resource slide. So we wanted to plug Maine Prevention Store, so they have free print and digital resources on all of these topics that we discussed, as well as a ton of other stuff. So it's free products and also free to ship. Um, your main prevention network partners, so Belle, that's me, Hannah and Sarah, um, are the main prevention network partners for Central District, so that's Kennebec and Somerset County. But depending where you are, it might be someone else. So I can also put a flyer for that in the chat that you can access if you're looking to connect with a different main prevention network partner, or you can reach out to me and or Sarah, and we can direct you to the correct person. The tobacco treatment resources, I also wanted to say that I do have what are called quit kits. So they're like little bags that have information about main quit link and some like mints and like a fidget toy that can help people with quitting. So if I see Wick is on here, if Wick is interested in getting some quit kits, I can definitely connect with you about that. And then, Anna, I don't know if you have anything else to say about the cannabis treatment.
Um, I do not, but I know that, yes, like you have the resource here about 221main.org or calling 211. You can also text them as well, which is a great resource.
Awesome. Thank you both so much for filling that in. Awesome. And there are your contact information plugs there. That is wonderful. What other questions do folks have for Anna and Belle while we've got them here? All right. Well, hearing no questions today, I want to thank you both today for presenting. That was absolutely wonderful. If you are not able to come to these live recordings, please feel free to check out our website, www.hccame.org, or visit our YouTube channel as well. All of our presentation recordings will be up there and available for the public to view. So thank you both so much for presenting today, and I will be stopping the recording. Thank you.